Assalamu alaikum. Today we're going to discuss anemia and sickle cell anemia with its ocular manifestations and as they are blood disorders. Sickle cell retinopathy, to be exact. Anemia is a condition characterized by a decrease in the number of red blood cells, reduced concentration of hemoglobin in the blood, leading to reduced oxygen carrying capacity. Although anemia primarily affects systemic health, it also has ocular manifestations in chronic or severe cases. In a study that included 294 anemic patients, they are irrespective of age and sex, it showed conjunctival pallor in 100% of cases, retinal hemorrhage in 35.71% cases, and diminution of vision in 28.91% of cases. The image here shows on the left. The image on the left shows a healthy conjunctiva, while the right shows conjunctival. Sickle cell anemia, it's a group of hemoglobin blood-related disorders. They are typically inherited. There's an abnormality in the structure of the hemoglobin leading to the sickling or the crescent shape of the red blood cells. They cause occlusions and they cause other disorders that we are going to discuss in specific as sickle cell retinopathy. There are two stages in the retina, non-proliferative and proliferative sickle cell retinopathy. Both share occlusion in the small arterioles of the retina that cause ischemia, while proliferative sickle cell retinopathy shows and triggers angiogenesis factor, vascular endothelial growth factor, that causes the new fragile vessels to form. These fragile new vessels are prone to bleeding, fibrosis, and traction, and may lead to retinal detachment. Some of the ocular manifestations of non-proliferative sickle cell retinopathy are the salmon patch hemorrhages, superficial retinal hemorrhages. This is a fresh drop of blood, as seen in this picture here. Depending on the body's reaction to this clinical picture, it may develop into black sunburst lesions if the hemorrhage persists and it is an old hemorrhage, or if the body breaks it down to form iridescent spots. They are refractile deposits from the blood breakdown. Moving on to ocular manifestations of proliferative sickle cell retinopathy. They follow the Goldberg's 5 stages. Peripheral arteriolar occlusion promotes arterioventricular anastomosis and causes neovascularization in the shape of C-fan-shaped vessels. They are at the junction of perfused and non-perfused retina, as shown here. Also, there may be hemorrhage in the vitreous from the neovascularization, and it may cause retinal detachment from the traction of the fibrovascular tissue. How to manage ocular manifestations? It falls under 3 categories: medical, surgical, and laser treatment. Medical management includes topical medications, avoiding carbonic anhydrase inhibitors, as they lower the pH and promote the sickling of the red blood cells. Surgical interventions, such as vitrectomy, for retinal detachment and epiretinal membrane. Prophylactic exchange transfusions may be recommended before surgery to reduce ischemia risks. And laser therapy such as laser photocoagulation are used to treat proliferative sickle cell retinopathy by neovascularization. Thank you.